We're talking about asthma. Our guest today is allergist Dr. Arthur Lubitz. He's assistant clinical instructor at the New York Medical College. And let's say hello to Robert from Florida. Hello, Robert. Robert, are you with us?
Yes.
Good. You're on the air.
Yes. I wanted to first say how much I enjoy your show Sonya. I began taking Theodore about 10 years ago when I was diagnosed as being asthmatic, and at that time it was 200 milligrams, and now I'm up to 300 milligrams daily, 3 times a day, and find myself getting tired about midday, and it increases. Is that caused by the Theodore increase?
Well, you know, it's hard to say specifically, but the Theodore is like caffeine. It's a stimulant, and so therefore a lot of times after people have been stimulated, they feel tired after the drug starts to wear off. One of the problems with asthma that makes it hard to control, and I want to stress this about Dr. Green's passing, is that you must not only deal with the muscle spasm, but you must deal with the chest congestion or mucus. And the problem with Theodore or theophylline in general, Theodore is one specific brand name, and also the beta agonists, is that they just deal with the muscle spasm. And cortisone or prednisone used at the right doses at the right time in asthma attacks will abate many of the deaths. But the problem is, because many people misunderstand prednisone to be crossed in their mind with some of the steroids used by male athletes, there's been very bad press, and some of the patients do not listen to their doctors and take cortisone at the proper times to abate the attack. So Theodore is a very good drug. You're on a rather high dosage, and you can have your level monitored. But one of the problems is it does not deal with the full spectrum of the asthmatic disease, which is the chest congestion, and that's one of my problems, is that the media tends to give bad press to some of the negative side effects of drugs, but properly used, one can avoid the side effects and get the benefits of drug therapy.
Thank you. We'll stay in Florida and say hello to Jean. Hello, Jean.
Hello. Hello, Sonya. Doctor, I'd like to ask a question about my daughter who gets asthma attacks. She's 17. She doesn't get them frequent anymore. It's like maybe twice a year. And I always wait for that time when she gets one, then I take her into emergency. Should she be taking something regularly on a regular basis, do you think?
Well, one of the main problems with asthma is that it can come on suddenly and be very severe and then be quiescent the rest of the